You might have heard the saying, "My biological clock is ticking," from movies like My Cousin Vinny, when Oscar-winning actress Marissa Tomei emphatically conveyed to her fiancé,
"Enough pressure on you already, but we agreed to get married as soon as you won your first case. Meanwhile, 10 years later, my niece, the daughter of my sister, is getting married. My biological clock is ticking like this, and the way this case is going, I ain't never getting married."
Biological clock has become a commonly used metaphor describing the pressure that many women feel to get pregnant during their most fertile years. For a multitude of reasons, more and more women are delaying having children until later in life, and their clocks are ticking much louder. Many older women optimistically believe that in vitro fertilization, or IVF for short, offers a successful way to become pregnant. Although IVF is a high-tech treatment, it's not a miraculous cure-all for infertility. The CDC recently reported that over 8 million women in America between the ages of 15 and 44 have difficulty getting pregnant or staying pregnant. The IVF success rate after 40 is a 9.4% chance of conceiving a woman's egg embryo and only 1 to 2% after age 45. The rate of infertility continues to increase globally. Infertility is defined as not being able to get pregnant despite having regular, unprotected sexual intercourse for at least 12 months. According to the World Health Organization, about 17.5% of adults, or 1 in 6 worldwide, have infertility. As a result, reproductive health is a global concern. In addition to aging, women's infertility can be due to many causes, including inflammation from sexually transmitted diseases, or STDs, biological causes such as abnormal ovulation, chronic endometriosis, blocked fallopian tubes, primary ovarian insufficiency, or POI, corpus luteum cysts, and polycystic ovary syndrome, also known as PCOS. Other causes can include poor nutrition, emotional stress, excessive exercise, obesity, smoking, drinking alcohol, drug use, or exposure to environmental toxins. Treatments including fertility drugs, surgery, freezing eggs, intrauterine insemination, also known as IUI, and assisted reproductive technology, or ART, such as IVF, are often inaccessible for many women due to the high costs, both financially and physically. So, what is IVF? IVF is a fertility treatment in which an egg is fertilized with sperm in a lab and then implanted into a woman's uterus. IVF is typically the final step in the fertility journey when other treatments have failed. Now, there are different types of IVF treatments. The options available are intracytoplasmic sperm injection, or ICSI, is a technique used where a single sperm is injected directly into the egg for fertilization. Frozen embryo transfer, or FET, is a procedure where embryos or fertilized eggs are thawed and placed into the uterus. Elective single embryo transfer, or ESET, is when one embryo is chosen from multiple available embryos and is placed in the uterus. Donor egg IVF uses frozen eggs from a young, healthy, anonymous egg donor from egg programs or a selected volunteer. Donor sperm IVF uses frozen sperm from a young, healthy, anonymous sperm donor from sperm programs or a selected volunteer. Mini IVF, or minimal stimulation IVF, uses lower doses of fertility drugs than traditional IVF during the egg stimulation process and transfer. Natural IVF, or drug-free IVF, doesn't require fertility drugs to stimulate the ovaries. Learn more about specific IVF medications and potential side effects in the link in the description below, and look out for the next video in this IVF journey series. Let's explore more about the IVF process. Now, before starting IVF, initial fertility testing and evaluation are necessary. The tests include comprehensive blood work, genetic carrier screening, transvaginal ultrasound to assess ovarian reserve, and evaluations of the uterus, SHG, fallopian tubes, or HSG. For the male donor, a complete medical history and physical examination, semen testing, sexually transmissible infections, or STI testing, and genetic screening are required. Male fertility problems account for up to 40% of infertility problems. After initial testing, the 4-step IVF cycle can begin, including Step 1. Oral contraceptive birth control medication is taken for 10 to 14 days to increase the number of eggs available for retrieval. Step 2. Daily injections of ovarian stimulation hormone drugs are administered for 9 to 11 days. This helps develop and mature follicles containing mature eggs for retrieval. Vaginal ultrasounds and blood tests monitor the ovaries. Step 3. An egg retrieval procedure is performed to extract the eggs from the ovaries. The male partner produces a fresh sperm sample, or the donor sperm is thawed, with the most active sperm selected. The eggs are given to the IVF lab, where they are fertilized with the partner's or donor's sperm. The fertilized egg or embryo is cultured for up to 5 days. Pre-implementation genetic screening can be performed to embryos to genetically analyze the embryos prior to transfer. Step 4. One or more embryos are transferred back to the uterus during a 20 to 30 minute procedure. There is a 9 to 10 day waiting period to see if the embryo successfully implants in the uterus. Finally, there's a 2-week wait before having a pregnancy test. IVF treatment can also be a fertility option for same-sex couples. Same-sex male couples, single men, and transgender individuals can combine IVF egg donation with gestational surrogacy. This is the method where a woman who did not provide the egg at conception carries a pregnancy for another person or couple. Same-sex lesbian couples can share in pregnancy through co-IVF or reciprocal IVF. In this procedure, the eggs are extracted from one woman, inseminated with donor sperm to create an embryo. Then, the embryo is transferred to the other woman's uterus to carry the pregnancy. IVF treatment can be more costly for same-sex couples than for heterosexual couples. This is due to federal and state laws and insurance policies that make it more difficult for them to receive fertility insurance coverage. However, federal and state lawmakers have introduced legislation to expand fertility coverage. Fertility drugs are taken to stimulate ovulation and are given in combination with other treatments, such as IVF. Often called IVF stims, these IVF medications are linked to numerous IVF side effects, including ovarian pain, headaches, and gastrointestinal problems such as nausea. The drugs in IVF also increase the chance of a woman having multiple fetuses during pregnancy. Other health problems include ovarian hyperstimulation syndrome, occasionally life-threatening, mood changes, physical side effects, a higher risk of pregnancy loss, and a higher risk of life-threatening maternal complications. Certain fertility medications are also linked to an increased risk of ovarian and endometrial cancers. Multiple fetuses, such as IVF twins, have a higher risk of being born too early, low birth weight, and death. The good news is that making healthy lifestyle choices can support fertility and IVF treatment. These include eating a healthy diet, limiting toxin exposure in your home or foods, managing stress and anxiety, maintaining a healthy weight, and avoiding alcohol, drug use, and smoking. Male partners should also follow this regimen. Supplements such as evening primrose oil, Vitex, chasteberry, B vitamins, vitamin E, and progesterone cream can help balance hormones and boost fertility. Essential oils such as thyme, clary sage, rose otto, and geranium can also help balance hormones and support fertility. Stay tuned for more videos to learn more about the medications prescribed for IVF and alternative natural methods that could be an ideal fit based on your doctor's recommendation.